All right, if we learned anything from the first presidential Democratic debate, it's that finding a health care solution is a major priority right now within the party. But not everyone is on the same page. Some contenders want Medicare for all. Some these ones here. Some favor a public option, but still private insurance. They cannot seem to agree on whether or not to eliminate private insurance companies altogether. Now, there are two major federally funded health insurance programs in place right now. Medicare, two of them are Medicare and Medicare Advantage. Medicare is managed by the government and covers adults who are 65 or older and certain younger people or certain people under the age of 65 with disabilities and those with end-stage renal disease. Now, the program, Medicare, is made up of three parts. Part A covers hospital stays, Part B covers certain doctor services, and Part D adds prescription drug coverage. All right, you must be wondering, what happened to C? Well, here's C. That's Medicare Advantage, otherwise known as the all-in-one alternative to original Medicare. Medicare Advantage is a health plan that's operated by private insurance companies who are approved by Medicare. It covers things like special needs plans and Medicare medical savings accounts plans. Now, none of these, neither Medicare nor Medicare Advantage, are the same as Medicare for all. Some people think maybe it needed a different name so it's not confusing. But this is the very thing that some Democratic contenders like Bernie Sanders and Elizabeth Warren are pushing for. It's for some reasons why you might not actually refer to it as a single-payer system, but for sake of argument, it's like a single-payer health care system that would replace private insurance along with replacing Medicaid and Medicare, and that would mean there would be not only no more private insurers, but no more Affordable Care Act. Joining me now is Kaiser Health News Editor-in-Chief Elisabeth Rosenthal. She's also the author of An American Sickness, How Healthcare Became Big Business and How You Can Take It Back. Elizabeth, thank you for being with us. I'm trying to make this clear. I hope I didn't confuse things more than was already confused. But if in 2020 Medicare for all gets enacted, what would that mean for people who are on a Medicare Advantage plan?
Well, you know, part of the problem is that the candidates have not been terribly clear. I like that this was all, or I was somewhat amused that this is all reduced to, you know, raising your hand, because, of course, Medicare embraces a whole lot of parts that are government-run, but also a whole lot of parts that we've outsourced essentially to the private industry. And as you said, it's not one plan, it's a bunch of different plans. If you want better drug coverage, you pay extra for that. So I think what Bernie Sanders and that camp are talking about really is like super Medicare. Again, I'm not saying where we should go, but there's a lot of details that need to be worked out to know if that's a meaningful proposal. And, you know, neither the politicians nor the voters have those at this point.
So if you look at countries, like most countries that have some form of universal health offering or health insurance, the question we're facing here that a lot of the candidates brought up is that a lot of people like me who are on private insurance may not want to give up their private insurance in favor of a Medicare for all or a single payer or a universal insurance program. That may well be true. The places that have these types of either single payer or universal health care that don't have an option, a private option, everybody gets covered. So everybody, all the doctors take the payment because the payment is made either by a central organization or by private insurers. Are we creating a false construct here where we're saying to people, well, we can't do this because you're going to lose your specific type of insurance? You've heard it referred to for union members. You've heard it referred to for employees with private insurance.
You know, to some extent we are, and to some extent the candidates often speak out of both sides of their mouth about this. I mean, a lot of the co-sponsors of the Medicare for All bills in Congress are on the debate stage, and they really don't want they will not say they want to do away with private insurance, which is what the Sanders plan would do. So, you know, I think, yes, some of us are really lucky that we have private insurance that's better than Medicare. Many people have private insurance that's worse than Medicare. So I think the middle ground that a lot of the candidates are proposing is a Medicare buy-in. So if your private insurance happens to not be as good, you can choose Medicare, which, hey, warts and all, it's a very popular program. When I speak to people in their 50s and 60s, they often talk about the promised land of Medicare. And sure, there are some surprise costs, but, basically most doctors and hospitals take it. And I think where we are in American healthcare right now, people are generally really, really frustrated. Now, I think the candidates that won't go there are worried not so much about maybe a little bit about pissing off some of the patients who have good insurance, but also they're very worried about the hospital and the insurance lobby that really doesn't want that kind of Medicare for all system.
That is the point that I was hoping you'd get to, because it is interesting the degree to which we are influenced as a whole in our politics by a remarkably strong lobby. Hey, MSNBC fans, thanks for checking out our YouTube channel. Subscribe by clicking on that button down there and click on any of the videos here to watch the latest interviews and highlights. You can get more MSNBC for free every day with our newsletters. Just visit msnbc.com/newsletters to sign up now.